College Hopco International welcomes you to Community Health Volunteer Training Module 4. Lesson 4, which will be about newborn and child health. Newborn and child health will cover a few sections. 1. Newborn care, newborn and child nutrition, and child development. By the end of this, the community health worker should have the following objectives: infant and child nutrition, demonstrate skills on care of newborn and infants, explain importance of growth monitoring and nutrition assessment, explain importance of immunization for infants and young children, explain the importance of vitamin A supplementation and deworming practices. Section 1, newborn care. Ways to keep the baby warm. You should dry the baby as soon as it is born. Put the baby to the breast as soon as the cord is cut. Kangaroo mother care. Ways to keep the baby warm. Avoid bathing the baby on the day of birth. If a bath is unavoidable, the baby should be bathed with warm water and dried and wrapped immediately. Comfortable warming clothes like hard socks wrapping the baby. Keep the room warm. Avoid carbon monoxide poisoning and suffocation from wood and paraffin stoves. Kangaroo mother care. This is early and prolonged skin-to-skin contact between a baby and a parent's chest. Which babies need kangaroo mother care? All stable, low birth weight babies less than 2,500 grams. Where should kangaroo mother care be done? At the health facility and at home. How long should kangaroo mother care be done? It should be continued until the baby attains at least 2,500 grams. Who can provide kangaroo mother care? Any adult can provide kangaroo mother care. Kangaroo mother care should have a follow-up weekly until the baby is 2,000 grams. Then the second follow-up should be every 2 weeks until the baby is 2,500 grams. Kangaroo mother care steps. Dress the baby only in a diaper, socks and a hat. Place the baby in a vertical frog position against the skin of the mother's chest. Place the baby's head slightly extended and turned to one side. Tie a wrap around the baby's back, covering the ear without constricting the baby's abdomen and chest. Kangaroo mother care benefits. Provides warmth to the baby. It promotes exclusive breastfeeding. It improves weight gain and growth. It reduces hospital stay and reduces infections and promotes bonding between mother and child. Care of the umbilical cord can be an entry point of germs. Keep clean and dry. Apply nothing to it. Avoid covering nappies. This may introduce germs to the cord. Signs of a sick baby. We have diarrhea. There is vomiting and fever, which can lead to dehydration. Give breast milk to prevent dehydration. No other fluids if less than 6 months. Accept or arrest medication. Babies who are sick recover quicker if they continue to have breast milk. If baby is sucking well, breastfeed more often, up to 12 times per day. If baby is not suckling well, express milk and give it by cup or spoon. If baby is no longer breastfeeding, seek a doctor immediately. Danger signs in newborns. When the baby is not breastfeeding well, when the baby is crying continuously, convulsions, unconscious, movement only when stimulated or none at all, fast breathing, which is greater than 60 breaths per minute, raised temperature, greater than 38, baby feels hot, reduced temperature, less than 35.5, baby feels cold. Newborn and child nutrition. Newborn and child nutrition. What do we feed babies for the first 6 months? Feed babies only breast milk until they are 6 months old. Breastfeed as often as baby wants, day and night, at least 8 times in 24 hours. Breastfeed as often as baby wants, day and night, at least 8 times in 24 hours. At each feeding, encourage the baby to empty the breast, then offer the other breast. Do not give babies other foods or fluids. Breast milk satisfies baby's thirst and hunger. What about giving the baby water? Do not give babies less than 6 months water. They should be exclusively breastfed. Breast milk contains enough water. If baby is given extra water, it will make the baby take less breast milk, which has important fats, vitamins, and minerals. What do we feed babies after 6 months? We can offer the baby clean water after breastfeeding to see if they are thirsty. Water should be either boiled or treated with water guard. Babies can now begin complementary feeding. Complementary feeding. Giving other foods in addition to breast milk is what is known as complementary feeding. Baby gradually becomes used to eating family meals. This is done between 6 to 24 months. Involves the introducing one food at a time to the baby's diet. Around the age of 2 years, the baby becomes used to family foods, which can entirely replace breast milk, although the child may still breastfeed. Treat for worms twice a year to maintain the baby's appetite and nutrient intake. Encourage the child to breastfeed and eat during illness, and provide extra food after illness. Prepare foods for children from 2 to 3 food sources. These include starches, legumes, vegetables, fruits, and animal foods at each serving. Try to feed different food groups at each serving. Children should be supplemented with vitamin A every 6 months until the age of 5. Monitor the child's growth monthly up to 5 years. Complementary feeding steps. Feed slowly and patiently. Encourage children to eat, but do not force them. Experiment with different foods. If children refuse many foods, try other combination, tastes, texture, and methods of encouragement. Minimize distractions during meals. The child may lose interest easily. Feeding time is learning time. Remember that feeding times are periods of learning and love talk to children with eye contact during feeding. Maintain high standards of hygiene during preparation of foods. Newborn and child nutrition. No complementary feeding before 6 months. WHO recommends exclusive breastfeeding until 6 months. Complementary feeding should not be delayed beyond 6 months. Micronutrient requirements are no longer met by exclusive breastfeeding after 6 months. Earliest introduction of cow's milk should be at 12 months. 0 to 6 months breast milk is best. Breastfeeding is encouraged up to 12 times a day. Breastfeeding at least 8 times a day plus 2 to 4 times a day feed. You can give soft porridge enriched with 2 to 3 colorful foods, orange and green fruits and vegetables, eggs, beans, lentils, or peanuts. Milk and butter or oil each time. Meat, chicken or fish. Development of feeding pattern. Development of trust in parent and capacity of self-soothe. Development of emotional autonomy, fine motor skills, and sense of independence. Babies don't need much salt in their diet, less than 1 gram a day. Canned food may contain large amounts of salt and sugar and should not be used for baby food. Foods to avoid in the early stages. These are reduced fat and wheat-based foods, confectionery, chocolate, mushrooms, sausage, smoked meats, mayonnaise, ketchup, peanut butter, citrus fruits, chilies, and other strong spices. Do not use honey in any form for the first year because honey has bacteria spores that can cause infant botulism. Whole cow's milk should not be added to the diet until the infant is 12 months of age. Do not force your child to eat all the food on his plate when he is not hungry. Give the new food for 3 to 5 days before adding another new food. Caregivers, parents should provide a variety of foods with texture and consistency appropriate to the infant's development stage and also promote healthy food preference. Fruit juices and sugar-sweetened beverages should be avoided during the first years of life. In addition, no sugar or salt should be added to complementary foods. Iron-rich complementary foods include meat products or iron-fortified foods should be given to all children. Appropriate complementary feeding has positive effects on optimal growth, body composition, neurodevelopment, health food preferences, gut microbial composition and function. Child nutrition. Feeding recommendation for children 2 to 5 years. Give family foods at 3 meals each day. Give nutritious snacks twice daily. Encourage children to eat different foods often. Child development. Child development. Child growth monitoring. Growth is the best indicator of a child's health. Well-nourished child leads to a healthy growth rate. Malnourished or sick child will lead to unhealthy growth rate. Child growth monitoring is done to assess the nutrition status of children. It allows objective detection of growth disorders at earliest opportunity for early intervention. It should be conducted every month from birth to 5 years of age. It helps to educate parents. It involves measuring and charting weight, height, head circumference, upper arm circumference, mid-upper arm circumference. Growth monitoring method to measure nutritional health for children ages 1 to 5 years. Green will show a healthy child, yellow will show mild malnutrition, and red will show severe malnutrition. If red, refer child to health facility. MUAC measurement steps. 1. Mark the arm's midpoint. Bend the left arm at a 90-degree angle. Find the top of the shoulder and the tip of the elbow. Keep the tape at eye level and place 0 centimeters at the top of the shoulder. Pull tape past tip of bent elbow. Measure half the distance of the shoulder to the elbow and mark. Or hold the tape at the shoulder and the elbow. Match the points to fold in half. Second, apply the MUAC tape to the arm. Straighten the arm and wrap the tape around the arm at the midpoint. Place the tape through the window. Ensure that the tape is not too loose or too tight. 3. Record the arm circumference. Read the measurement to the nearest 0.1 centimeter in the window where the arrows point inward. Record measurement and color. Growth chart monitoring, mother-child booklet. It contains a chart to record growth monitoring. Should be taken to health facility visits even when the child is sick. If the child's age and weight is plotted in the red color, pay attention to future monitoring. Counsel on appropriate feeding practice. Above white color, overnutrition or overweight. Below white color, underweight or undernutrition. Malnutrition. This is a lack of proper nutrition. Not having enough to eat, not eating enough of the right things, being unable to use the food that one does eat. Types of malnutrition. We have undernutrition, which is less nutrients that the body requires. Underweight, thin or stunted growth. Overnutrition. Diets that provide excess energy. It can lead to nutrition-related diseases that develop over a long period of time. Dangers of overnutrition can lead to heart diseases, types 2 diabetes, high blood pressure, bone disease, depression. Dangers of undernutrition leads to increased risk of infections, breathing problems, depression, anemia, stunting. Stunting, this is height when the height is less than expected compared to a healthy population. Height for age is low. It is common in Kenya. 1 in 4 children are stunted. Rural children are twice as likely to be stunted. Signs of undernutrition. We have marasmus, which is characterized by emaciated or extremely thin, no fat on body, and ribs are visible. Thin, flaccid skin, hanging in loose folds, old man's appearance, loose skin around the buttocks. Hair changes color to yellow or reddish and becomes sparse, dry and brittle. Can be pulled out easily, leaving bald patches. Frequent association with dehydration. Alert and irritable. Usually has appetite. Signs of undernutrition, kwashiorkor, severe swelling, edema, beginning in the lower legs and feet, can be more generalized, hands and arms, and they have a moon face. They have reduced fat muscle tissue, which may be masked by edema. They have damaged skin or different skin color, cracked and peeling, with patches, patchy and fragile, prone to infection. Hair changes color. It's yellow or reddish and becomes sparse, dry and brittle, and can be pulled out easily, leaving bald patches. Frequent infections due to skin lesions. Apathetic and lethargic. Irritable when handled. They have poor appetite. Frequent association with dehydration may be masked by edema. Immunization. This prevents children from getting certain diseases. Immunization schedule. When at birth, vaccine given, BCG, birth polio. Diseases immunized against, we have TB and polio. When at 6 weeks, vaccine given, OPV1, Pentol 1, PCV1. Diseases immunized against: diphtheria, pertussis, tetanus, pneumonia, meningitis, otitis media, and bacteremia. At 10 weeks, the baby is again supposed to be immunized. Vaccines given: OPV2, Pentol2, PCV2. Diseases immunized against: diphtheria, pertussis, tetanus, pneumonia, meningitis, otitis media, and bacteremia. At 14 weeks, OPV3, Penta3, PCV3, IPV. Diseases immunized against: diphtheria, pertussis, tetanus, pneumonia, meningitis, otitis media, and bacteremia. 9 months, measles, yellow fever. Vaccines given is measles and yellow fever. Vitamin A supplementation. Importance for a healthy immune system, growth and development. Children with vitamin A deficiency are more likely to suffer from infections such as measles, diarrhea, and malaria than healthy children. It should be given twice a year from 6 months to 5 years. It helps the body use iron and for good eyesight. Deworming. The procedure to get rid of intestinal worms, done to all children above 1 year at 6 months intervals up to 5 years. Maintains appetite, enhances nutrient assimilation and food efficiency in the body.